It's having a huge impact on people's mental health. I think it's definitely contributing to a lot of anxiety. We're already seeing I'm already seeing a lot of patients come to me with telephone consultations, video consultations, saying it's actually increased their anxiety levels considerably and their mood is lower because of what's happening around the globe. And I think that's not just because, yes, people are worried about getting coronavirus, even the young and fit and healthy, but it's what impact will it have on their children, what impact will it have on their elderly that are living with them, or anybody in the vulnerable risk group that is living with them. I think more than that as well is the anxiety around how are they going to get through all of the government measures across the globe. People have to pay rent, people have to earn their wages, their weekly wages. What about the self-employed? So I think the financial and economic impact of coronavirus is adding to anxiety considerably, for sure. If there was somebody already with a pre-existing diagnosis of depression or anxiety, they're going to be at particularly higher chance of being worse off as this pans out, especially because social isolation, isolation and being on one's own or having to sort of really keep away from people is not really good for mental health, especially if you have anxiety disorder. We're keeping away from people, so we're never going to have a social conversation, how's your evening going, what plans do you have, or what are you doing this weekend, as we normally do in an office environment. As colleagues, as employees, as friends, we have to recognize any changes in people's mental health digitally or rather virtually. And I think some of the signs could be if you do seek, if you are in a meeting with somebody and you're in a video meeting, if they look particularly withdrawn, particularly not engaging, poor eye contact, those could be some physical sort of signs of, deteriorating mood. But I think people's productivity might go down, they may not meet deadlines, and I think that it's really important to just verbalize and say, are you okay? And just that is enough to recognize a warning sign or recognize that something else may be going on, so people can open up. Asking, do you need help? Are you okay? Is there anything particularly you want to talk about? I think that is number one. I think giving dialogue is particularly important. Keeping active. I think everything else may be cancelled, but going for a walk in the park is not cancelled. So definitely keeping active, keeping outdoors if you can for a little bit of the day will help. Keeping a routine helps as well, I think. I think that, it's very easy in the morning to just wake up, sit in your pajamas, log in, and then just do the routine, your job without really a routine, but setting your time, getting up, getting dressed, doing the meetings, having a routine is definitely going to help. And the other thing is be creative. I think the other thing is that there are other ways to keep yourself occupied. If you need time away from your screen, could you do some painting or knitting, a new hobby? Something creative is definitely going to refocus your mind away from ruminating thoughts about anxious feelings. If you did have anxiety or depression, I think make sure you speak to someone about it, and there's always a GP at the end of a phone call or a video if you ever need it. And we're still seeing patients, so we're not turning everybody away. We're still seeing patients. We're just trying to keep the footfall down so that we don't infect everybody.